The IATF expands the list of foreign nationals who are allowed to enter the country, just days after it lifted the travel ban on nations with the new COVID-19 variant. To give us more details on this, we have Maricel Haliri reporting live from Mandaluyong. Mase, could you tell us who are the foreigners who are now qualified to enter the country?
Charles, despite the threat of the new COVID-19 variant, the Philippine government has decided to allow more foreign nationals to enter the country starting February 16. These are the foreign nationals that have or who have visas issued as of March 20, 2020 and are still valid and existing at the time of their entry. Others who are allowed to enter the country are holders of valid and existing special resident and retirees visa and Section 9A visas. These should be presented along with an entry exemption document to the Immigration Bureau upon arrival. Despite the expanded coverage for the entry of foreign nationals, there are certain conditions that must be followed. Foreign nationals are required to have a pre-booked accommodation for at least 6 nights in an accredited quarantine hotel or facility. They are also subject to COVID-19 testing at the quarantine hotel on the 6th day from the date of arrival. And foreign nationals are subject to the maximum capacity of inbound passengers at the port and date of entry. Palace spokesperson Harry Roque, however, clarified that foreign tourists are not yet allowed to enter the country. He noted that the Foreign Affairs Department hasn't resumed the issuance of tourist visas since last year. Meanwhile, the Interagency Task Force also adopted the recommendation on the criteria for allocation of the first batch of Pfizer vaccines. The one-tranche delivery will be provided for healthcare workers. The updated priority groups are the following. First in line will be the frontline workers in health facilities, both national and local, as well as private and public. These include health professionals and non-professionals like students, nursing aides, janitors, and barangay health workers. This group will be followed by senior citizens aged 60 years old and above, persons with comorbidities, frontline personnel in essential sectors including uniformed personnel, and indigent population. They are followed by teachers and social workers, other government and essential workers, socio-demographic groups, and OFWs. Those are the bottom of the list, and the remaining workforce and the rest of the Filipino population. Charles, so far the Interagency Task Force has also approved the recommendation of Baguio City to allow their hotels to accommodate leisure travelers. And also, they have approved the recommendation to allow government officials as well as government personnel to travel in any part of the country without following the health protocols or the mandatory test protocols, rather, of the local government units of their destination. It means that, well, they don't have to undergo the required test per local government unit. So I just want to be clear about that, because there are other protocols that are being implemented by the airports, by the airlines, so they still have to follow those protocols. Charles?
Thanks for that, Maricel Halili, reporting live from Mandaluyong.